Thank you so much for joining us here at Abu Dhabi Global Healthcare Week. I wanted to kick off by sort of getting a sense from you about the opportunities when it comes to, frankly, democratizing health.
I've really enjoyed this past 2 days. I've seen the future that is being built and created here in Abu Dhabi with the new technologies, genomics, AI coming into place, and the future being really built by technologies and under very strong leadership here in Abu Dhabi. The question you asked is an interesting one. How can that progress that we can see here be democratized in the rest of the world? And this is a question that I leave this country with me because it will take a lot of efforts on bringing these new technologies down to the level where people don't have access to facilities, just primary healthcare facilities, not even hospitals. It is about bringing these technologies into potentially the mobile phone of community health workers and empowering them with all the capacity the new technologies are bringing, or if we can go even further, going down to the level of the patients. But there is a track that is the track for the most advanced world, for the most affluent world, and there's a track that is for the least fortunate, most vulnerable, and I think finding the connection will be critical to respond to your question of democratizing all the progress that is happening here.
No doubt. It's something that we've looked at since the pandemic. How do we democratize health and healthcare? Obviously, the WHO was at the forefront of the endeavors to fight the COVID-19 disease. When you think about what happens next, are we better placed to combat another pandemic?
We are slowly getting better placed, but I don't think we are ready for the next pandemic, which may hit at any point in time. So there's been a lot of efforts from the technology side during the pandemic, and afterwards we were able to come up with a vaccine in less than 1 year, and now there's an organization like CEPI that is trying to get this target down to 100 days. We have learned about genomic sequencing and how that can be done faster and faster to allow for quicker production of countermeasures. We have done a lot of progress in surveillance and connecting system and data system to be able to detect and activate a response faster. So there are a lot of gains that are coming from the technological field. There are, I think, gains that are trying to be made on the political side. In a couple of weeks in Geneva, there will be hopefully the finalization of an agreement around the pandemic accord. That is important. We know that the countries that have been most effective at reducing the impact of COVID were the ones that had the strongest political leadership. Think New Zealand, think Vietnam, think United Arab Emirates, where there was a clear direction. It's very important to bring that political leadership and that commitment at the highest level, and with that, the solidarity that will allow a more equitable response, which is where COVID response sadly fails short. And there's a lot of work, I think, that still needs to be done.
Talk to me about this in the sense that obviously you're coming from the WHO Foundation. You have the opportunity to really look at those public-private partnership opportunities. What are some of the conversations that you're having today?
Well, we have had a very interesting conversation with the pharma world and these are ongoing on how to make those countermeasures available in countries. These are tough negotiations ongoing, and I cannot predict where this is going to go. We'll discover it in a few weeks' time. But the fact that these conversations are happening is very important. The ability of, on the other side, strengthening the capacity for manufacturing in countries, in low-income countries, is absolutely important. We've had exceptional conversation with partners like Spotify, like MSD, like Sanofi, creating coalition that we have at the WHO Foundation is called the Global Health Emergency Alliance, that brings together these partners to respond to emergencies, to mobilize resources in favor of the World Health Organization when an emergency hit. And we want to do more of that, just bringing the partners together around topics that are of critical interest and importance. Can be pandemics, but can be emergencies or other areas like bringing digital technologies into countries. So I look forward to these public-private partnerships. We are working together, also going with philanthropies that are very often have the capitals that can be put forward, taking a more risk approach to see whether this new initiative will actually take off, having a higher acceptance for potential failure. But that kind of dynamism that brings together government, private sector, philanthropies, and organizations like the WHO is the future of health. And
in your mind, how important is the communication? Because obviously, COVID-19. There was a lot of miscommunication, I think.
Talking to a journalist would be difficult not to stress the importance of communication, but indeed, we saw that communication can save lives. Communication, unfortunately, can kill. And communication happens nowadays at all levels. We have seen exceptional politicians that have used their power to communicate around preventive measures to bring communities and individuals together. We have seen the opposite. We have seen politicians using their power on air to pass messages that were wrong, misleading, and generate a very much opposite reaction to desired. We have seen religious leaders critical in the response, and they are exceptional communicators. Working with religious leaders across the world of all faiths is going to be very critical. We have seen the power of traditional media. I have directly been engaged and had the pleasure of working with incredible journalists that really helped at a moment of crisis to pass the right messages. I've also been in forum where journalists were trying to get opposite views just to see the blood on camera, to be very frank, and not to the aim of improving the public health and improving the response. And then I would like to say last one element of communication, which is the communication at the level of the communities. And it's there that is the communication between doctor, primary health care, community health workers, and the people that is absolutely critical. And all these links of communication are based on one very tiny aspect that is often disregarded but is so powerful, which is trust. And a lot of trust was lost, broken during COVID. I think at all levels, trust needs to be rebuilt, and we need to focus on that.
It's great having you here at Abu Dhabi Healthcare Week. Thanks so much for joining us.
Thank you for having me.